So this particular whole training, what we want to know is this, is that who are marketing our companies? Okay, who's our marketers? So when we ask owners this, we say, okay, are you a marketer? Guaranteed, 75% of them will say no. That's not my job. I don't do that. I don't know how to do that. That's why we hire somebody else. That's why I have you here to help us train our new marketer. So they'll say those things to me. But the truth and honest of everything is this. Everyone in your team is a marketer. If you're a medical home health agency, your marketers, your DONs, your administrators, your nurses, everyone in the office staff, any outside staff, even the people that are literally serving your companies, delivering your water to you, your mailman, etc., etc. All of those people that surrounding your market, your agency, are marketers for your company. And you need to utilize them in every aspect, from creating power partners to teaching everyone in your team on how to market your company. I literally teach agencies that your caregivers should always have their own business cards. Your nurses should all have business cards at any given time. Even your office staff should be having business cards, because at any given moment when they're out in the field, they may meet people, they can give them a business card. And even nurses, they get so giddy when you give them their own business cards, because it makes a person feel special. It makes a person feel special to have their own business cards. It gives them that, they belong to a society. They belong to this company. Other than having their ID badge, a business card is a proof that they're somebody. So use that as a very good tool. So other than who are your marketers, how many full-time marketers do you have? So if you're starting up a company, more likely you don't have one yet, but we want to be able to guide you to how to be able to hire the right one correctly. Now, a lot of companies don't even have a single marketer, and they've been in the business for so long. But you can only grow to a certain level depending on what you're staffed with. So eventually, if your ultimate plan is to grow your business, you need to increase the ability of people to know who you are and break past that obscurity. So if you want to expand your company, you need to double your marketers. You need to triple your marketers, quadruple it. That will increase the chances of you having a successful home health agency. Now, the next thing is this. When you have your marketers, or if you don't have a marketer, let's say you're marketing the company for now, how many times a week do you go out marketing? I've gone into agencies and they tell me that they're having problems with getting referrals. And I ask them, how many physicians have you called this week? 0. How many physicians have you visited within the past 2 weeks? 1. How many nursing homes have you visited, within the past 3 months? None. This is literally a nursing home that I just dealt with about 2 months ago. Well, that's why you're not getting referrals, because you've been happy with the current referral source that you have, but when they leave, remember how I told you guys earlier about increasing your funnels, increasing the amount of referral sources is the most important thing for a successful home health agency. So if you're not going out there a lot of times, then that's going to cause problems. So typically I've seen it where smaller companies, smaller home health agencies, their marketer is the administrator is the payroll person, same person that also handles, your scheduling. Well, marketing is a full-time gig. It's a full-time business. And the worst part is typical average marketers don't even have the tools that they need to market their companies, or the training or the knowledge. Imagine if you also are having to do administrative work, do payroll, do scheduling, do intake. Because I've seen this happen where I've seen that owners and administrators do this also. Well, then you're not spending enough time on the most important part of the business, and that is getting clients. One of the biggest things I'm against a lot I see with people in our industry that are support companies for home health agencies is that they're giving you training to show you how to code correctly, how to be able to have great clinicians, but none of them is pushing you guys to learn the techniques on how to be able to get patients. Because the way you guys are going to be successful is if you have patients coming in and you're able to bill correctly and you're able to generate income for the company to be able to pay for the staff and keep it afloat. It's a circle of life, but it always starts with your marketing. You know, when they say, is it the chicken or is it the egg? In home health agencies and home care companies, it always starts in the marketing campaign. It always starts there. And you guys need to understand that. Now, other than how many times a week do you go out marketing, how many new leads per week do you meet? So you can go out there marketing, but visit old referral sources and not visit new referral sources. Every week you need to have a detailed plan of how many new leads you need to visit, or if you're managing a marketing team, how many they need to visit. And that needs to be made and made out clearly. Not just tell them, oh, just go out there and do what you need to do. And that is typically what's seen, is because people that are hiring new marketers, they just want to hire a marketer that has experience, is what they say. Me, I rather hire an inexperienced marketer, but have a great training service like what I provide, where we can train the marketer from scratch, tell them how we want to market them, how we want them to market the company. That's the most important part, is to have training, to actually have something to give them, have a detailed policy and procedure for them to follow to how to market a company. So it doesn't matter if they're an experienced marketer. Just because they're an experienced marketer, that does not mean that they're a great marketer. Most agencies want to hire that home health marketer who has experience. And my answer to that is this, is that if that person is looking for a job, why is he looking for a job? Because if he's a great marketer, whichever company he's working for will not want him to go and will make sure they give him more money and great money. Because that's the only way that they can keep him. So I will always ask somebody, why are you looking for a position? Because if you're looking for a position, then it makes me question, what type of a marketer are you? So you need to create new leads per week. That's very important, and you need to be able to have that goal there. Very much important so. So, next thing, and this is very important for marketers. How many times do you visit your current referral sources? If you have referral sources right now, when's the last time you visited them? Okay, so what I'm asking here is literally this. Most marketers, most companies will have a new referral source. They start referring to them. They say thank you. They take care of the patient, but they never create that bond. They forget to follow up, to add that personal touch. So just because they started referring to you, that doesn't mean you stop courting them, okay? It's like a relationship, remember. Just because they said yes, that doesn't mean you stop giving them flowers. Just because they said yes, that does not mean you stop talking to them. So what you have to do is you always have to show yourself out there. And if you're the administrator, the owner of the company, don't just let your marketers have that relationship. You should have that relationship with that particular referral source as well. Here's another problem. Do you have independent marketers? If you have independent marketers, or don't know what an independent marketer is, let me explain to you what they are. These are marketers that will say they don't want to work full-time for you, or they'll come in and they'll claim that they have a list of a bunch of patients that they already are working with that they can definitely bring to your company to start using. So you want to avoid having these type of independent marketers. And if you suspect the person's an independent marketer, give me a call. I'll help you weed it out, and I'll talk to that marketer and find out more about them for you, because you want to avoid these type of marketers, because these are the marketers that will take your patients and bring them to another home health agency as well. So you don't want these type of marketers. Very, very hard to be able to have them, okay? So make sure you do not have these type of marketers within your midst. You need to literally know all of this. It's very important. Very, very, very important. Now, the next important question to ask you is this.